Carotid arteries anatomy. Let's explore the common and external carotid arteries, their branches, and key clinical points in a simple way. Common carotid arteries. There are two common carotid arteries, right and left. They are the chief arteries of the head and neck. Origin: the right common carotid artery arises in the neck from the brachiocephalic trunk, innominate artery, behind the sternoclavicular joint. The left common carotid artery arises in thorax, superior mediastinum, directly from the arch of aorta. It ascends to the back of the left sternoclavicular joint and enters the neck. Cores, termination, and relations. In the neck, both arteries, right and left, have similar cores. Each artery runs upwards from the sternoclavicular joint to the upper border of the lamina of thyroid cartilage. Opposite the disc, between the third and fourth cervical vertebrae, where it terminates by dividing into internal and external carotid arteries. The internal carotid artery is considered as a continuation of common carotid artery. They are named as internal and external because the former supplies the structures within the skull and latter supplies structures outside the skull. Each common carotid artery lies in front of the transverse processes of lower four cervical vertebrae. Branches: the common carotid artery gives only two terminal branches, that is, external and internal carotid arteries. Clinical correlation: carotid pulse. The common carotid artery can be compressed against the prominent anterior tubercle of transverse process of the sixth cervical vertebrae, called carotid tubercle, Chesenak's tubercle, by pressing medially and posteriorly with the thumb. The carotid tubercle of the sixth cervical vertebra is located about 4 centimeters above the sternoclavicular joint, at the level of the cricoid cartilage. Above this level, the common carotid artery is superficial, and hence its pulsations can be easily felt. The carotid pulse is the most constant pulse in the body. External carotid artery: it is one of the two terminal branches of the common carotid artery and supplies the structures external to the head and in front of the neck. Cores and relations: the external carotid artery extends upwards from the level of the upper border of the lamina of the thyroid cartilage to a point behind the neck of the mandible, where it terminates in the substance of the parotid gland by dividing into the superficial temporal and maxillary arteries. Branches: the external carotid artery gives rise to 8 branches as follows: Superior Thyroid Artery, Lingual Artery, Facial Artery, Occipital Artery, Posterior Auricular Artery, Ascending Pharyngeal Artery, Maxillary Artery, Superficial Temporal Artery, Superior Thyroid Artery. It arises from the front of the external carotid artery, just below the tip of the greater corneal of the hyoid bone. It runs downwards and forwards to reach the upper pole of the thyroid gland, which it supplies. Branches: Superior Laryngeal Artery, Trichothyroid branch, glandular branches to the thyroid gland, Lingual Artery. It arises from the front of the external carotid artery, opposite the tip of the greater corneal of the hyoid bone. It is the main artery to supply the blood to the tongue. It may arise in common with the facial artery, linguofacial trunk. It is divided into 3 parts by the hyoglossus muscle. First part lies in the carotid triangle and forms the characteristic loop with convexity upwards above the greater corneal. The loop permits free movement of hyoid bone. Second part lies deep to the hyoglossus muscle, along the upper border of the hyoid bone. Third part, also called arterioprofunda lingui, or deep lingual artery, runs upwards along the anterior border of the hyoglossus muscle, and then forwards on the undersurface of the tongue. Facial artery, formerly called external maxillary artery, it arises from the front of the external carotid artery just above the tip of the greater corneal of the hyoid bone. It is divided into 2 parts, cervical and facial. Cervical part of the facial artery ascends deep to the digastric and stylohyoid muscles, passes deep to the ramus of mandible, where it grooves the posterior border of the submandibular gland. Then it makes S-shaped bend, first bending down with convexity upwards over the submandibular gland, and then up with convexity downwards over the base of the mandible. Facial part of the facial artery begins where the facial artery winds around the lower border of the body of the mandible at the anterior, inferior angle of the masseter. Occipital artery. It arises from the posterior aspect of the external carotid artery at the same level as the facial artery. It runs backwards and upwards under cover of the lower border of the posterior belly of digastric muscle, superficial to internal carotid artery. Then it runs deep to the mastoid process, grooving the lower surface of the temporal bone, medial to the mastoid notch, to reach underneath the trapezius muscle, which it pierces 2.5 centimeters away from the midline and comes to lie just lateral to the greater occipital nerve. It supplies most of the back of the scalp. Posterior auricular artery. It arises from the posterior aspect of the external carotid artery, a little above the occipital artery. It crosses superficial to the stylohyoid muscle. It runs upwards and backwards, parallel to the occipital artery, along the upper border of the posterior belly of digastric muscle, and deep to the parotid gland. Ascending pharyngeal artery. It is a slender artery that arises from the medial aspect of the external carotid artery, near its lower end. It runs vertically upwards between the side wall of the pharynx and internal carotid artery up to the base of the skull. Superficial temporal artery. It is the smaller but more direct terminal branch of the external carotid artery. It begins behind the neck of the mandible, deep to the upper part of the parotid gland. It runs vertically upwards, crossing the root of zygoma in front of the tragus, where its pulsations can be felt. About 5 centimeters above the zygoma, it divides into anterior and posterior branches which supply the temple and scalp. Clinical correlation: superficial temporal pulse. The pulsations of the superficial temporal artery can be readily felt in the front of the tragus of the ear, where it crosses the roof of the zygoma, the preauricular point. It serves the usual purpose to anesthetists, to whom the radial pulse is not available during surgery. For this reason, it is also called anesthetist's artery. That was a quick overview of the carotid arteries. Like, share, and subscribe for more medical videos.